some in-depth and comprehensive discussion is there about the health sector in our country. And this very informative document has been uploaded in the PAB website. So we will try and learn the important things from this document. Okay. The name of the document is Prioritizing Healthcare for a Viksit Bharat 2047. And this is document has been released as part of the budget 26-27 series. Okay. Some key takeaways are there. Okay, we will come back to the takeaways. What are the important takeaways? First, some introduction is there with respect to health scenario in our country or the health statistics. So we will see that. Okay. India's healthcare landscape is undergoing transformative phase. Okay, we know that very well. The burden of communicable diseases is coming down compared to the non-communicable diseases. I'm not saying disease burden has reduced, but now more and more people are falling prey to the non-communicable diseases compared to the communicable diseases. That is the transformative phase our health scenario is in. Okay. Further, the budget 26-27 driven by the insights of the economic survey 2025-26 has established a comprehensive roadmap for universal health coverage. Okay. So you see, still this is unrealized in our country, universal access to health without any hindrance, whether the person is living in rural area or urban area, belongs to upper caste or lower caste, whether rich or poor. Okay. Whether male or female, okay, without any discrimination, there shall be access to healthcare facility or health facilities, or for that matter health services. Then you call that as access to universal healthcare is available. Unfortunately, this is not available in our country, and the government, the document is saying that the government of India is laying a roadmap for the same universal health coverage through infrastructure development, preventive care, and digital integration, focusing on youth, underprivileged, and elderly populations. Okay. The budget prioritizes non-communicable diseases. Yes, the reason we know, because now the burden of NCDs, non-communicable diseases, has become more than the communicable diseases. Okay. At the same time, it also trying to strengthen the traditional medicine. Ayush is there, we know very well, and mental health services and biopharma sector also. Okay. Then some statistics or data is there from the budget. We will see that the Ministry of Health and Family Welfare has been allocated rupees 1,06,000 crore rupees, a 10% increase from FY 25-26 revised estimates. You see, when you are showing something as a percentage of revised estimates of the previous budget, there is no use. Okay. You say how much you have increased from the previous year's budget allocation. Okay. First you say you show some figure in the budget, this much we are going to spend, but when it comes to revised estimates or actual estimates, it will be far lesser than the budget announcement. I hope in the coming future the government or especially the finance ministry will try and address this problem. Okay. Right. However, 10% increase from the financial year 25-26 revised estimates. Remember, not the budget estimates. Then 194% rise over 12 years. Of course, this percentage may look very bigger, but inflation is increasing. Okay, GDP has also grown, population has also increased. So 200%, near 200% increase also not substantial, I would say. Okay. Further, the Department of Health Research has been allocated 4,821 crore. Okay, so we have to do work. We have to work on R&D. R&D is very poor in our country. Maybe reasonable amount, I would say, or it's reasonable that the R&D segment has been provided the amount. Okay. This rising government expenditure demonstrates a strong commitment towards universal healthcare and medical research innovation. Okay, I personally do not agree with this statement that rising government expenditure. First of all, it might be rising, but it is not rising to the desired level. You see, minimum 2.5% health expenditure shall be, minimum 3%. At least we, think that minimum required is 2.5%. We are not even close to even this minimum 2.5%. Percentage as a percentage of GDP, you see, health expenditure, we are not even close to 2.5%. Okay. So I personally do not agree with this statement of the rising government investment in healthcare is actually take us towards the universal healthcare. Okay, still have some concerns about it. Okay, anyhow, the statement is there. It's from the government side. Okay, then in the budget, we will see in the budget, latest budget, we will see healthcare related announcements. So first one is the Ministry of Health and Family Welfare's budgetary allocation increased from last year's revised estimates. That is compared to revised estimates, it's a 10% rise. Okay. Then the overall trends you can say beginning from 2012 to 23, data is given up to 2023-24. So actual estimate, I think these are actual figures. 80,000 crore has been spent in 2023-24. Okay. This is the actual health expenditure. Okay. All right. Then many health initiatives were allocated more funds this year. Okay. So individually, data is given how much they have been allocated. Pradhan Mantri Jan Arogya Yojana has been allocated 9,500 crore rupees. It was earlier previous revised estimate. You see, it's not the budget estimate. Okay, budget, something will be announced. Then definitely there is going to be lower expenditure than what is announced in the budget. So based on that figure, you are saying this year we have increased allocation, but I am 100% sure that this much will not be definitely spent. So this percentage of increase that the document tried to show, I don't believe it has full sanctity. Anyhow, percentages are shown how much has increased. On National AIDS Control and STD, Sexually Transmitted Disease Control Program, quite a lot of increase is there. Increase in allocation is there. Actually, it's not actually increase in allocation. You have to say that previously allocated budget, funds have been not utilized. Actual spending is less. Even then, now this year money has been allocated. So we have to wait and see whether this will be utilized or not. Okay. And blood transfusion services also substantial increase is there. Then etc. etc. Some other aspects are there. You can go through that. Okay. So some analysis is there about this allocation. Funding for the Ayushman Bharat. Ayushman Bharat Pradhan Mantri Jan Arogya Yojana this is launched in 2018, we know very well, has been steadily rising, but not rising sufficiently or enough. As the world's largest public healthcare scheme, this PMJ, it provides health insurance up to 5 lakh rupees annually per eligible household, making quality healthcare affordable for over 12 crore vulnerable families. Okay. Funding for other schemes has also increased over the decade, okay, responding to India's evolving health landscape, etc., etc. So I would say, of course, it might be increasing, but not sufficient. That is my concern. Then expenditure on PMJ has also been traced. You can go through the trends, budget estimates, revised estimates, and then actuals. Okay, some years actual estimate expenditure was more than the allocation. Some years it was less. Next, we will see the new initiatives that have been announced in the budget 26-27 with respect to health. Okay, right. So first one is Biopharma Shakti scheme. If you see the key components or strategy of this program, 3 new National Institutes of Pharmaceutical Education and Research, NIPERs, they have been announced. Plus, the plan is to upgrade the 7 existing NIPERs. Then second one is establish a network of over 1,000 accredited clinical trial sites. Okay, clinical trials are very important in finding out a new drug. Okay. Then further, third one is under this strengthening Central Drugs Standard Control Organization, CDSCO, with a dedicated scientific review cadre and specialists. Then biologics and biosimilars production for NCDs, okay, non-communicable diseases like diabetes, cancer, autoimmune disorders, etc. Targets and coverage, if you see, outlay of rupees 10,000 crores for over a period of 5 years. Okay. Then second initiative in the budget is tax exemption on cancer drugs. If you see the features of this one, full exemption of basic customs duty on cancer drugs, 100% customs duty exemption on drugs and medicines for 7 additional rare diseases. Then target is 17 new cancer drugs covered under this initiative or under this incentive. Then emergency and trauma care, if you see that, to establish emergency and trauma care centers in district hospitals, that decision has been made. Then 50% increase in capacity in the district hospitals. Okay. All right. Then with respect to mental health care infrastructure, key decisions, if you see, establish second National Institute of Mental Health and Neurosciences. Okay. It's called as NIMHANS 2 in North India. Second one is upgrade National Mental Health Institutes in Ranchi and Tezpur to regional apex institutions. Then target or coverage, if you see, expanding access to advanced mental health care, training and research facilities in North India. Then another initiative announced in the budget is geriatric and allied care. NSQF aligned programs will be initiated. Trained multi-skilled caregivers will be deployed. Then care and additional allied skills, if you see, wellness, yoga, operation of medical and assistive devices, they will be able to operate them. Then target and coverage, if you see, training 1.5 lakh caregivers in coming year to address the long-term care of elderly. Then allied health professionals, AHP training. This is another announcement in the budget. Okay, key components or strategy, if you see, upgrade the existing AHP institutions, establish new AHP institutions, government plus private, both. That will cover 10 disciplines like optometry, radiology, anesthesia, then OT technology and services, applied psychology, behavioral health. So these areas will be covered. Target is adding 100,000 AHPs or 1 lakh AHPs over next 5 years. Another announcement is regional medical hubs for medical value tourism. Key components, if you see, partnership with the private sector, integrated healthcare complexes like medical education and research, Ayush centers, medicinal or medical value tourism facilitation centers will be initiated. Infrastructure for diagnostics, post-care rehabilitation will be developed. Job opportunities for doctors and allied healthcare professionals. Target is 5 regional medical hubs have been announced. Okay. Then international growth of Ayurveda, to set up 3 new All India Institutes of Ayurveda. Then upgrade Ayush pharmacies and drug testing labs for higher certification standards. Evidence-based research, training, awareness for traditional medicine. Then upgrade WHO Global Traditional Medicine Center in Jamnagar, Gujarat. Okay. Target or coverage, if you see, 3 new All India Institutes of Ayurveda will be started. Okay. Right. So the trend or transformation I was talking about, that's the rise of non-communicable diseases, and in the entire health burden of our country, their percentage has become 57%. Sorry, more than 50%. We will come to that. So we will see the information about rise of non-communicable diseases. So the recently released economic survey 25-26 highlights the critical shift in India's health landscape. The nation has achieved a significant progress in tackling maternal and child health and increasing life expectancy from roughly 50 years in 1973 to 70.3 years in 2023. It now faces a rising health challenge. What is it? It is non-communicable diseases such as cardiovascular diseases, means diseases related to heart and the blood vessels, then diabetes, obesity, and cancers. Okay. NCDs accounted for 57% of deaths in the country in 2021-23. So that is what? Okay. NCD burden has crossed this threshold of 50%. Earlier, communicable diseases like malaria, okay, other communicable diseases, their burden used to be more, which can transmit from one person to another person. So what is the solution for this one? The solution is preventive and promotive healthcare infrastructure in India for NCDs. Okay. Some details are there. NCD screenings as per October 2025, that is given. Okay. Individual data is there. Okay. Then National Health Mission, actual transfers to states under this National Health Mission are also given. You can go through the figures. Then Ayushman Arogya Mandirs have also been initiated. So operational Ayushman Arogya Mandirs are 1,84,000 plus roughly across the country. Latest data. Then NCD infrastructure, if you see as of February 2025. Okay. Community health centers, okay, and NCD clinics are 6,410. District NCD centers are 770. District daycare centers are 372 and cardiac care centers are 233. Okay. You see, over the years, the funds approved for state government state program implementation plans have increased. So the increase trend has been shown. So there is decline in this particular year. It is because of maybe COVID-19. Okay. We have to divert money for something else like MGNREGA. Otherwise, it is steadily increasing. That is what you can say. Okay. So funds approved for the states to tackle NCDs increased nearly fivefold from 2019-22 to 2024-25. Latest, it is 1,43,000 crore rupees. Okay. We have to see how much of this approved money will be actually released to the states. That also we have to see. Then if you see Ayush and the traditional medicine from civilizational knowledge to a global health ecosystem, global health ecosystem. So we are trying to promote this Ayush and the traditional medicine also. Okay. So some information we will see about that one. India's traditional knowledge systems have evolved into globally recognized health frameworks. So some people love our country because of yoga, etc., etc. Further, post-COVID, demand for preventive care has driven wider acceptance of already popular Ayurveda and Ayush systems. Okay. The Union Budget 26-27 positions Ayush as a contemporary health, wellness, and economic opportunity benefiting farmers who are cultivating medicinal plants and youth in processing, thereby advancing public health, rural incomes, and India's global soft power. Then Ayush national infrastructure has also been discussed here. Registered Ayush practitioners are some 7,55,000. Ayush hospitals are 3,800. Ayush doctors are 24,000. Ayush pharmacies are 3,400. Ayush, paramedics are 2,200. Ayush dispensaries are 36,000. Then undergraduate Ayush colleges are 886. Postgraduate Ayush colleges are 251. Annual intake capacity is 59,000 for UG and 7,400 for PG. Okay. Ayush services co-located in public health facilities is 2,300 PHCs, 713 community health centers and 306 district hospitals. Ayush services are co-located, means they are there along with the allopathy care services. Okay. Then budget allocations are also there. Budget 26-27 has emphasized a lot on the traditional and Ayush medicines. The Union Budget 26-27 marks a decisive transition for Ayush from expansion to consolidation, quality enhancement, and global leadership. transforming it from practice-based systems into scientifically validated global health disciplines, etc., etc., etc. A lot of information is there, theory is there. In highlights, we have seen already, and there is conclusion also. Okay. So once again, we will see the highlights. What are the highlights of this document? Okay. The Union Budget 26-27 has increased allocation for the Ministry of Health and Family Welfare by 10%. Okay. 1 lakh crore roughly from the revised estimates of 25-26. So this is the catch. Then 100% customs duty exempted on 17 new cancer drugs. Budget targets training 1 lakh allied health professionals and 1.5 lakh caregivers over the next 5 years. Budget proposed establishing 3 new All India Institutes of Ayurveda to meet growing global demand and upgrade the WHO Global Traditional Medicine Center in Jamnagar. Okay, so this is what is there in the budget with respect to health sector. Of course, it's not comprehensive enough as I have expected, but still lot of important information is there in this document. I hope you will, understand it, get it, remember it, and use it in the examination. Okay, both the prelims exam and mains examination. Okay, right. See you next time. Until then, you have a very good time. See you next time.